Welcome to our 2023 Utah Health First Broker Education Day. We're gonna do this a lot quicker than a 2-hour block like we normally do live, so you don't have to sit through that. But it'll be about a half an hour long. We'll try to keep it there. So we're gonna skip over some stuff that's not so important, and then we'll really hammer some of the things that are important for 2023 moving forward for OEP. So we'll get started here. So what does Health First do? So there's a lot of new agents to us this year for OEP 2023. So we're going to go over what we do. And so first and foremost, we do 100%, we give 100% of your commissions. We pay out that same day. It's direct deposited. We reconcile your commissions as well. So not only will you get like a normal commission statement, but you'll also get a reconciled commission statement. It'll show your clients A to Z. It'll show the month that you were paid on. If there's any deviation to that commission payment month after month, it'll flag it red or green. If you weren't paid on it, it'll show a nice blank, so you'll be able to easily comb through and see who you haven't gotten paid on that month. And you can rectify that. We also have contracts with every single carrier in the state of Utah that does ACA plans on the marketplace. So we're the only general agency in the state that has that. So if you do need other contracts other than the ones you have, come and chat with us, call, text, email the green line, and we can help with that. Sales support is kind of what we do. So really, those other things, contracting and commissions, that's just the tip of the iceberg. Hence the picture over on the right. But sales support's really where we're at. And so you're going to get all kinds of different tools to make your job and your life much easier, especially during open enrollment quoting systems. You'll get access to our broker portal, Agent Intel. It's got a ton of information in there. Also, our placemats. If you don't have one, reach out to the Green Line. We'll bring one out to you during open enrollment whenever. But you definitely want one of those, and that has all of the carrier's information on it as well. We also do marketing materials. So every year, our marketing team puts together some marketing materials that you're able to use on Facebook, videos, stuff you can put, you can mail it out, whatever you want to do with it, flyers, all kinds of stuff. So we'll also go over that a little bit later in the presentation. So Book of Business Monitoring, also known as Bob. This is something we've been working on for a few years actually, but working with the carriers, also with Health Sherpa, to gather as much data on your clients as possible so that we can help you identify when there's any sort of change to your book of business. So if somebody loses a subsidy or somebody's child got kicked off a plan, we can notify you that day. We compare these this book of business file to a previous file the day before, and notify you if there's any changes. So that's something that we are really trying to make sure is looking good here for 2023 and more. So there's a lot more. We're not going to go into all of it today, but just know that we are here to help you, and that's our job. We are located in South Jordan. So here's the address here. You can pause the screen, you can write it down, whatever you want to do. That's a temporary office while our current office is actually being built. It was supposed to be done in the middle of this month, but this picture was just taken a few days ago, so you can see that is not going to be done this month. So we're kind of looking towards beginning of next year, and that'll be about right, rather than trying to move during open enrollment. So all right, let's jump into changes for 2023. This is a chart that shows premiums and the percentage of change from 2022 to 2023. So you can see at the top in green, we have SelectHealth. Their bronze plans are going up about 15%. You can see some of these silver plans have stayed the same, gone up a little bit. The University of Utah has, changed negligibly. Molina took a different approach. Looks like they've gone up quite a bit in their silver section and their gold section. Cigna's gone up. And then Regence also kind of adjusted things a little bit here and there. So this is a good depiction as to what you should expect from the carrier this year in 2023. So this slide actually shows all of the different carriers and how they stack up against each other in different counties. So if we look up at the top, we see all of the bronze plans. In the middle, we have a chart for silver plans. In the bottom, we have all the gold plans. So you can find whatever county you're really interested in. Maybe right in the middle, you're interested in the Salt Lake and Davis County on the silver plans. So you can see there's a lot of green there. There's some blue. Really in the bronze sector, it looks like SelectHealth and Regence are really going to win out. In the silver, in Cache Rich, Box Elder, Morgan counties up north, SelectHealth and Regence are really going to be competitive. So this is a good chart for determining who's going to really win out this year in terms of market share. So you can see in red, the University of Utah is towards the top. They're the most expensive plans, and really in all of their categories. So we're not going to be seeing a lot of them, a lot of Cigna, a lot of Molina, but we should see quite a bit of SelectHealth and Regence this year. All right, we're going to move on to carriers now. We're going to start with the departure of BrightHealth, RIP BrightHealth. They have decided to not offer plans this year in 2023. So if you have any clients that are on a BrightHealth plan, make sure that you're helping them find a suitable replacement. More than likely, they're going to go to Regence. They're the non-IHC network, and they'll be the most comparable in price. So Bridgespan, no one should have been on a Bridgespan plan, although there are 66 enrolled lives for some reason. They discontinued all their plans in 2022, but don't worry, they brought you 4 new 2023 plans. So no one should be using Bridgespan. They're just kind of a sister company of Regence. RIP Bridgespan. Molina. It was a tough year for Molina in 2022, and it's still going to be the same thing here for 2023. They have no bronze plans still. They've discontinued all of their plans except for one silver plan and one gold plan. So they also have no zero deductible plans without a 94% cost share. So last year they did have one. So if anyone was on that, know that that's gone away, and that's going to get crosswalked to their silver one. They are raising their premiums 29% statewide. So that's a significant tidbit. But they are decreasing their area factor, their rating area factor in Cache and Rich County by 8% and 17% in Iron and Washington County. So that actually directly coincides with those premiums that they're raising statewide. So you take that 29% minus 17%, and that's what you'll actually get your actual factor for Iron and Washington County. They still have their award-winning customer service. Hopefully, they're going to take a step back this year and make some changes there. But so RIP Molina, but do keep in mind that they do have the largest network in the state. So and by far. So they actually, if you have a placemat, look at that, and it'll show you what percentage of primary care physicians and specialists each carrier has in the state. So you can see that Molina actually has 81% of primary care physicians in the state, 82% of specialists, whereas the Med Network has 62% of primary care physicians and 41% of specialists. So they have a huge network. So just keep that in mind. If you do have somebody that has a lot of different physicians, they may still need that Molina network. So let's move on to Cigna. Cigna lost Primary Children's Hospital this year. That was kind of a big deal. We're not really sure how you do that, but they did. So there's no Primary Children's Hospital in Cigna. So RIP Cigna. their rates weren't they're not going to be great here this year anyway, and hopefully they'll rebound in 2024. But keep in mind that all their plans are 100% EHB, so you're actually going to be able to see them as a zero premium bronze plan in certain counties. So just keep an eye out for that. They have really, really good diabetes care plans. And so if anyone is a diabetic, any clients you have, they probably still want to be on one of these Cigna plans. So the University of Utah, we love them. I wish they would do better when it comes to rating their plans, but they got rid of their preferred network this year. So RIP to the preferred network. RIP to San Pete, Rich, and Cache counties. They pulled out of those 3 counties. They did bring in a new network, a very, very slim network called the UHealth Plus network. So this is an 8% discount on their premier network, which is crazy. It should be much higher than that. An 8% discount seems very, it doesn't seem very good to me. So, and you saw the chart. It's not going to be good for them. So they, of note, they also have a huge rating area increase in Utah County of 24%. So keep that in mind. All of their plans are also 100% EHB, so they will also be eligible for zero premium bronze plans. So keep an eye out for that. All right. Most of our time today is going to be spent on SelectHealth and Regence. They're the 2 carriers that are actually going to be big this year. SelectHealth is every year, and so we're just going to kind of notify you of some changes, and we're kind of really dive into some of the special things that Regence does. So let's start with SelectHealth. This year they discontinued their catastrophic plan, their expanded bronze 6,800, 8,700, and 3,800 plans. All 4 of those plans will actually be crosswalked to the expanded bronze 6,900. So not a great year to auto re-enroll your clients. So if they were on any of these plans, they're going to get crosswalked to a plan. And if they had a $3,800 deductible and they're being crosswalked to a $6,900 deductible, there's going to be some really upset people. So make sure that your clients are aware of this. Make sure you're aware of this. Do not auto re-enroll clients this year. Make sure that you're paying attention and that you put them on the best plan for them this year. Not all plans are available on all networks. So not like in years past where every plan was available on every network. There's certain plans that are only available on Signature and that are only available on Med and Value. So just keep that in mind. You'll need to pay attention there. You'll be able to see that on the quoting system as well. So they do have a new off-exchange silver HSA plan. The HSA plan, their HSA plan is actually has 15% of the state population on it. So it's a very popular plan, the silver HSA. So adding a new one is kind of nice for them. It will only be off exchange. They are going to have some preventive medications for specific chronic illnesses, diabetes, asthma, COPD, and this will be available on all of their plans. It used to only be available on their HSA plans, but that's been expanded to all of their plans. So we'll actually have a list of all of these on Agent Intel, so you'll be able to see and compare between carriers and their preventive drug list. They copied Cigna this year and they did a diabetes support plan. So Cigna is now no longer the only carrier that does a diabetes support plan. SelectHealth has one. That's nice because Cigna was only available in a few counties and SelectHealth is available statewide. So really diabetes was not only found in Salt Lake and Davis County. And so it'll be really nice that clients will have access to these types of plans statewide. Their benchmark plans are 100% EHB. So other carriers, all of their plans are 100% EHB. SelectHealth's benchmark plans are 100% EHB, and they will actually be eligible for zero premium on the bronze and in certain silver instances. So keep a lookout for that. We talked about this a little bit, but they had some increases on their bronze plans, but they also have a rating area increase in Iron and Washington counties of 7%. So add another 7% to that 15%. Some of those bronze plans are going up 22%. So be aware of that for any clients that are in southern Utah. They also came out with a new platinum plan. This is significant because they are the only carrier that has a platinum plan this year. But because they offer a platinum plan on the exchange, they are now required by CMS to offer a standard platinum plan. So they'll actually have two platinum plans. And of note, the standard platinum plan has a $3,000 max out of pocket. The premium on that plan for, a 21-year-old is actually only about 50% higher than the cheapest silver plan available for that 21-year-old. So there's a lot of cases where getting a platinum plan this year will be a really good idea, especially for those that know they're going to meet their max out of pocket. So on this plan, it's so good that having a baby, you won't even meet your $3,000 max out of pocket. You'll probably hit about $1,500 or $1,800 of it. So I think it's going to be a hit this year. So just be on the lookout for that. All right, so we're going to spend a little time here with Regence, getting to know them. They have spent the last few years really trying to be competitive in the marketplace space, which is really, really nice to see. Because we've seen other carriers try, but they've done a really bad job. Regence is doing great. So a contender appears. So their SaveWell network, they have two networks. They have their SaveWell network and their IFN network. SaveWell is still hanging on. It is not a great network, and I would suggest not putting anyone on it. It's a little too confusing, and it's not a great network. Their IFN network, or their individual family network, it's a 4-state network. So it's available here in Utah, parts of Idaho, parts of Washington, and I believe all of Oregon, or maybe it's all of Washington and parts of Oregon. But in any case, it's a large network. For urgent and emergent care, if you're out of the state, out of their 4-state network, their Blue Card gives you access to urgent and emergent care in network. Also out of the country, BCBS Global Care is worldwide. So really, really got a nice network there. All of their bronze plans are going to be 100% EHB and thus eligible for a zero premium. So another note. They had chiropractic benefits on all of their plans last year. Because they changed to 100% EHB this year to give people the opportunity to have zero premium plans, a chiropractic benefit will not be on any of the bronze plans, only on their non-standard plans. So their HSA has an embedded deductible, whereas SelectHealth has a non-embedded deductible. And so if you have any questions on the, embedded versus non-embedded, we actually have an article in Agent Intel on that. Go ahead and look that up and educate. They also have their optimum value medication list. This is a huge list. I think it's like 180 medications, but this is this actually waives the deductible for like 6 different categories of chronic illnesses and their medications. So this is a really, really nice list of medications. Not preventive, but they're suited for chronic illnesses. So this will make it much cheaper for those on these plans. One thing to note is if a brand name is chosen when a generic drug is available, the member will pay the difference. I guess it's kind of on all plans, but just make sure that they understand that. They can't appeal that, or I guess maybe appeal is not the right word, but they can do step therapy for that. Like I said, that's a very common practice, but just be aware that they can do step therapy if they're unable to take that generic. Their IAP. This is a great benefit. Really, really good benefit. If anyone does any small group plans or any commercial plans with Regence, their EAP, their Employee Assistance Program. This is just the same thing, just on the individual side of things. Why it's called the IAP. This gives anyone in the household, so not necessarily anyone on the plan, but anyone that lives within the household of the insured, 4 free sessions per unrelated issue of therapy. So this is for mental health. after those 4 free sessions, then it's the in-network copay, and that in-network copay is actually the primary care physician copay, so not the specialist. But if they have another issue that's not related, they get 4 more free sessions. They can continue. Like I said, they will just actually pay the PCP in-network copay. That is only available on the non-standard plan or the non-EHB plan. So any plan that has 100% EHB, it won't be available on. Once again, because of that 100% EHB designation, they can't have all these extra little frills. They do have an accident death benefit on all their plans. This is a $10,000 death benefit for any adult on the plan. I guess we shouldn't say adult. It's actually $10,000 per subscriber and $10,000 for spouse. If they have any children that are over the age of 18, they don't qualify for the adult. They're still considered children. So their benefit is $2,500. The only kicker here is that the death must result from an accident while covered within 365 days of the accident. So usually we don't go into all these weird little things, but we want everyone to kind of know and understand Regence because they're going to be a big player this year. And these are actually really cool benefits that they're offering. So one thing we need to note, one negative here, is because they changed from 99.7% EHB to 100% EHB, all of their bronze plans are going to be crosswalked to a silver plan due to that EHB change. So that's not Regence's doing, that's CMS is doing, but no matter who's doing it is, once again, it's a reason to not auto re-enroll your clients. Make sure they know that their plan is going to get crosswalked from a bronze to a silver. Their premium is going to change drastically. They need to be actively renewed in a different plan, or the exact same plan, essentially, just with a different EHB percentage. So just keep that in mind. They do have a new broker portal that is coming. That's awesome because their current portal is terrible. I'll be very honest. It's terrible. Really no value there at all whatsoever. So the new broker portal is actually going to be really, really nice. Going to have a ton of value in it. They were supposed to have that ready here for open enrollment. Looks like it won't be ready till the end of this final quarter of the year. Really, I just hope it's out for January 1st. Nobody should really be using the broker portal anyway during open enrollment. It'll be after open enrollment that you'll be using that. Your credentialing for Regence must be done by October 31st by midnight. This is a 26-question test. There's no time limit on it. You have unlimited attempts. You have to pass with an 80%. At the end, it's going to ask for your name, your email address, and your producer ID. This is not your NPN. It's actually specific to Regence. You can find that in your broker portal. That's not so useful, but it does have your producer ID in there. Save your certificate just in case, but go ahead and do that. This will actually get you better commission. We'll be sending out an email, a PDF that has all of the commission and bonus breakdowns as soon as they're finalized by the carriers. Okay, quickly I'm going to hit National General. For those that don't know of National General, they actually have changed their name to Allstate. They were bought by Allstate. The branding has just changed over, actually just a few days ago. So they offer short-term plans. If you're not contracted with Allstate or National General, please contact us via the green line. We'll get you contracted, squared away there. These are great plans, much better than selling a Christian cost-sharing ministry plan. These are actually regulated by the Department of Insurance. They don't cover maternity, prescription medications, pre-existing conditions. So keep that in mind. These are for healthy people that don't have pre-existing conditions. Please don't sell them otherwise. Their accident medical enhancer is a great supplement for those that are on bronze plans that have high deductibles, high max out-of-pockets. These fill in the gaps, so if they have an accident, they'll get a nice benefit amount that they can use towards their max out-of-pocket or their deductible. They have varying benefit amounts. They also have a few other riders so that you can cover them for cancer, heart attack, stroke, also for critical illness hospitalization. But we have a specific placement for National General, and then also for our next carrier, Best One Dental. So Best One Dental premiums have stayed about the same. Once again, if you aren't selling Best One Dental, you probably need to. This is a great dental product. We're not huge advocates of individual dental with all their waiting periods and this and that, but Best One Dental is the best one that we've found. Premiums are staying the same. They have great premiums. It's about $95 for a family for a $5,000 annual maximum. There are no waiting periods, although they do reduce the benefit their first year. So that'll be on the placement. If you have any questions on this, please call us and we'll get you squared away there. They also have a vision discount plan embedded in the plan. And they have a direct broker enrollment link, so that's embedded with your broker code, so your clients can actually sign up on your link, and you'll get credit for it in commission. So, in our education day, we went over and demoed Agent Intel. Agent Intel is our broker portal. So to sign up for access for Agent Intel, head over to agentintel.com. Click on the login button, click on sign in with Google. Make sure you sign in with your work Google account. So if your work account is not set up on Google, reach out to the green line number listed below here. You can call us, text us, and we'll get you instructions on how to set up your work account as a Google account. And then we'll grant you access to Agent Intel. You're definitely going to want this. This is a place for you to search for doctors, prescription medications, facilities, and it'll show who's in network with all of the carriers rather than having to go to each different carrier's site to look for it. Same thing with prescription medications. It'll show you which tier it is covered by the carrier and all that. So it's a great resource. There's tons of videos and trainings in there, FAQs, all kinds of stuff. So definitely go sign up for Agent Intel. QuoteMeal Plus is our new quoting tool. We've been using the same version for the last 3 or 4 years. So this is a huge upgrade to the current quoting tool. You're definitely going to want to use that. You'll be able to access your quoting tool in Agent Intel under QuoteMeal, under the QuoteMeal tab. So definitely sign up for Agent Intel. Mess around with QuoteMeal Plus. You're going to love it. And let us know if you have any questions on that as well. I wanted to hit marketing real quick. Every year we do some marketing, and I talked a little bit about it at the beginning, but figured I'd show you a few little social media posts that we have ready. These will all be white labeled to you. You'll have your information on there. You'll be able to post them on your website. You'll be able to post them on Facebook and Instagram and all that kind of stuff. I've got some flyers that you can also print out. This is just a small sampling, but everybody is going to get access to this. It's actually going to be sent to you via email in a folder, and it's going to have all of your information on there. You won't need to do anything. You get it. Even if you don't want it, you'll have to throw it away. So, also wanted to touch on Health Sherpa. We believe that Health Sherpa is an amazing enrollment platform. It's much better than healthcare.gov. It keeps your clients, it keeps them organized. It notifies you of those that need to turn in proof of income or anything like that. It gives you deadlines. You're able to filter by it. It's a great tool. It really helps with the renewals. It's a nice snapshot of your client and their subsidy and everything else. So please use Health Sherpa. We feel like it's a great tool. It's free to use. You can actually add us as your agency. Our agency code is 92B9. So you can go into your settings and you can actually add us in there as your agency. The reason why we would like everyone to do that is we verify information that we get from the carriers on your clients. We actually will verify it against Health Sherpa. And so we have kind of two sources of truth, or sometimes the carriers are off on certain things and Health Sherpa isn't, and sometimes Sherpa's off on things and the carriers aren't. So it gives us a really accurate look on clients, and it helps us to perform better when it comes to your daily book of business report. So please sign up for Sherpa if you haven't. Add your clients in there. If you have any questions on that, there's videos and agent intel. You can always call us. We'll help you get set up with it, walk you through it. It's a great resource and it's free. So thank you so much to everyone for joining us. I hope I kept that short and sweet. Like I said many times throughout this entire presentation, we are here to help. Health First is for you, and so we work for you as a broker. We value your independence, and our broker support team is here to help you with anything that you need anytime. Call us at the Green Line number 801-889-1997. You can text, call that number. You can email us at greenline@hfrocks.com. We are glad to help. So thank you again.